Tonight,
I took a selfie and I noticed these lines going across my forehead.
My goal for my patients, I want them to look like themselves, but just the best version of themselves.
It's not about looking younger. I just want to go into this next phase a little more gracefully.
R&R, Rejuvenate and Renew. Your guide to cosmetic surgery, sponsored by Penn State Health Milton S. Hershey Medical Center.
Good evening, I'm Deborah Pinkerton. How often have you looked in the mirror and said, what can I do about my acne scars? Or what about that wrinkle? Or what about that sunspot? And then asked yourself, should I do something about it? Well, you're not alone. We all have at some point. Tonight, you will see someone take the next step with Botox treatment live right here in the studio. And if you have questions at home, Christina Butler is here to tell you how to get them answered. Hi, Christina.
Hi, Deborah. Specialists from Penn State Health Milton S. Hershey Medical Center are behind me in the abc27 call center to answer your questions until 8 o'clock. Call the number on the bottom of the screen, or you can email your question during the show to questions@abc27.com. Plastic surgeon Stacy Henderson will answer your emails throughout tonight's show. All calls and emails are confidential. I'll be back in a few minutes to share some of those questions with you. Deborah.
Thanks, Christina. Hershey Medical Center has some exciting news. Plastic and cosmetic surgery are now working together in one location. Take a look.
The new center is a multidisciplinary cosmetic center, and it's a culmination of a dream that I, and fortunately a number of other people, have had, of getting a group of people together from different disciplines to offer comprehensive services in the cosmetic field.
This is where the dream comes to life, here inside these walls. Let's take a look. Specialists in cosmetology, dermatology, facial plastic surgery, and plastic surgery will fill these offices.
We have medical estheticians who will offer a full range of skincare and skincare products. Our dermatology colleagues will offer a full range of laser treatments, as well as fillers and Botox. The facial plastic surgeon will be mainly focused on rhinoplasties, facelifts, and blepharoplasties. The oculoplastic surgeon will be offering services related to eyelids primarily. We'll offer the full range of body services, breast augmentations, abdominoplasty, body contouring, liposuction. Whatever our customers want, we'll have it in one place.
And joining us is Dr. Donald Mackay, the Division Chief of Plastic Surgery at the Med Center. So tell us about this new cosmetic center. It looks great.
Well, as I said in that earlier clip, this was the culmination of a dream where we had a number of different disciplines, all who have an interest in cosmetics and cosmetic surgery. And we now have them all working together in a single site. It is exciting. It's a lot of fun.
Why did you decide to open this new center now?
I think that there's a lot of work in this area. There are a lot of opportunities, and I think that a lot of the folks in the mid-state feel that they have to leave the mid-state and go somewhere else to get the kind of services that us and many other practitioners offer, and really they don't. We can offer a full package.
And now they can stay right here.
And they can stay right here.
Give us some examples of the different services that you do offer at this new facility.
Well, I think you saw the list of all the different disciplines that are involved, and really we cover everything from the top of the head to your toes. Facial plastic surgery, rhinoplasties, facelifts, body contouring, breast reductions, augmentations, lifts, body lifts. And I'm forgetting a lot of other things.
I was going to say the list seems to go
long list
on.
with a lot of highly trained experts in the field.
And how does having everything in one center really benefit the patient?
Well, I think it's unique in that we really have the full range, and that's what's unique about this. And there's no need to necessarily go to two or three different sites. We've got all the services in one area.
And so if someone wants to talk to one person and then they may have a recommendation just to walk down the hall to see the next.
Absolutely. Yeah, that's the idea.
Okay, why don't you give us the address, phone number, if someone would like to make an appointment?
So I've got to look it up again. It's 5 Capitol Drive, and it's close by the shops at Susquehanna.
In Susquehanna Township?
In Susquehanna Township. Easy access off the highway.
And it's what, Suite 203, and what is the telephone number there? 717-5?
531-1386.
Okay, great. Dr. Mackay, thanks so much for being here and showing us this new center.
Thank you very much. Appreciate it.
And why don't we check in now with Christina Butler in the ABC27 call center. Christina, it seems like it's busy over there.
It is, Deborah. It keeps getting louder and louder as these calls come in. Experts are behind us, and you can call in with your question. The number is 717-346-3333. And plastic surgeon John Potocny is here to share some answers to some of these viewer questions. So let's check out our first viewer question. She writes, I've thought about having breast reduction surgery due to back pain, but I'm concerned about the cost. How often is a cosmetic procedure like this covered by insurance? I'm sure this is a question a lot of people have.
It's a common procedure we do too. So more than 50% of the time, these things can be covered by insurance. The best thing is to come in for a consultation to see whether you might qualify for that.
Okay, and we have another question here.
Sure.
This viewer writes, I'm only 54, I've smoked for years, and now I have wrinkles on my face. Is there a way to permanently remove wrinkles surgically or through some other procedure?
Well, there are certainly ways to improve that. The first and most important is to quit smoking and avoid too much sunlight. And after that, there are some things we can do, such as chemical peels, laser treatments, or a professional sanding known as dermabrasion of the skin.
Okay, so first you stop and then you work to reverse.
Yes.
Okay, great. Thank you so much. Again, you can call the number on the bottom of your screen. You can also email us questions at abc27.com. Deborah, back to you.
Thanks, Christina. Coming up next, you will see a patient receive Botox live. You won't want to miss it. Stay right there. We'll be right back.
You're watching R&R, Rejuvenate and Renew, your guide to cosmetic surgery on ABC27, sponsored by Penn State Health Milton S. Hershey Medical Center.
Welcome back. As we learned earlier, there are all kinds of cosmetic procedures. A Hershey couple found some easy solutions for some of their concerns. Maria Memi and Phil D'Addario take lots of pictures, family vacations, sporting events. One picture is all it took for Maria to take a second look.
A couple of years ago, we took the girls to a Syracuse basketball game, and I took a selfie of the three of us, and later I looked at it and I noticed these lines going across my forehead, and I just felt like I just was starting to really look older.
I think for their loved ones, you know, I think they love them no matter what, you know, whatever wrinkles and all, I guess, you know, I think that's the way I feel anyway.
But as a wife and a mother of 3, Maria wanted her face to reflect how she felt.
Well, I would say for a couple of years, Botox had been on my mind. And I kept thinking, oh, I wonder when that phase of my life is going to start, and will I do it? And I was very nervous.
Maria decided to make an appointment with dermatologist Dr. Charlene Lamb.
A lot of my patients, and certainly in Maria's case, they want to look like the best version of themselves. And so these non-invasive procedures are a great way to extend and prevent some of that aging process.
She has me do certain facial expressions. She takes a little marker and marks my face.
She doesn't like the forehead lines, the lines in between her eyes. And we are able to use neurotoxin, also known as Botox, to soften some of those wrinkles so she doesn't have those lines etch in. We use very, very tiny insulin-like needles to inject a small amount in to the muscles themselves, targeting those muscles and preventing them from continuing to contract and etching the lines into the skin. So it's more of a maintenance prevention process.
I love it. Getting the Botox, I mean, it literally changes your appearance to being more relaxed or fresh looking or not so tired.
My goal for my patients is not to look frozen or plastic or overfilled. I want them to look like themselves, but just the best version of themselves.
It's not about being younger or looking younger. I just want to kind of go into this next phase a little more gracefully.
Yeah, I'm completely fine with her doing anything cosmetically. Botox to me was something that if she wanted to do, it seemed relatively innocuous. So if it made her feel better, then I was all for it.
Around the same time, Maria's husband, Phil, was concerned about some sunspots on his face. While getting that taken care of, Dr. Lamb talked to him about a new procedure for double chins.
Within the past few years, we have a new product that came out called Kybella, or deoxycholic acid. It's the first product that was used to address that area in a non-invasive manner.
She just said, this is a procedure where we inject a solution under your chin.
Similar to the Botox, it's injected into underneath the chin, so it feels like maybe a little bit of a bee sting.
And you'll have some real swelling for a couple of days, but then over time, what this solution does is basically eat the fat that's under your chin.
Phil went for 3 treatments and he was satisfied with the outcome.
And I said, minimal risk, minimal time with a lot of upside. That's kind of what I look for.
I think the results look great. It really has defined the chin area and it looks very natural.
I am a firm believer with a lot of these cosmetic things. When you do look good, you feel good about yourself. So you have more confidence. I think everything helps. But I think it has to be done for you.
In fact, Maria is very happy with the results. She's here with Christina in the studio. Christina.
Hi, Deborah. That's right. Maria and her doctor, Dr. Charlene Lamb, are here in the studio, and they're actually going to give us a live demonstration of Botox. So before we get started, though, Dr. Lamb, sometimes when you hear the chemical term for Botox, neurotoxin, it can sound a little intimidating or scary, maybe. So talk to us about its safety.
I completely agree. I feel like the name makes it very scary and seem unnatural, but actually it's been used for 30 years, was proven to be very safe. It's actually used for other medically indicated conditions, and the amount we use in the cosmetic setting is minuscule in compared to those.
Okay, and we got a viewer question about these other uses. They write, I've heard Botox can be used for people who grind their teeth or have migraines. Can you explain how Botox works in these situations?
Similar to the way they work in cosmetic settings, Botox can relax muscles and make them not contract as hard. So in conditions of grinding your teeth, the temporalis muscle up here kind of controls your jaw, and if you can relax that, you can stop some of that involuntary grinding.
Okay, that's good to know. Maria, let's bring you in here. Talk to us about the first time you got Botox. Were you scared? What were you feeling?
I wouldn't say so much scared, apprehensive and nervous, and I had been considering it for a long time, talking to other friends. I'm very fortunate, and I know a lot of people in the dermatology world, so having a lot of conversations and educating myself. And then once you do it, I was like, oh, okay. Once you just kind of rip the Band-Aid off the first time, and then it was not bad. I had it worked up so much more in my head than really what it turned out to be.
And we saw in your story, did you get support from your husband too to do this?
Oh yeah, he's great. He's great about supporting me. Yeah.
Okay, great. Okay, and we can begin here. And Dr. Lamb, can you just walk us through step by step what you're doing as you start here?
Absolutely. So the first process is that we want to make sure to clean the skin with the alcohol swab to make sure we keep everything nice and clean. So that's just what we're doing now.
Okay.
And what I'll have Maria frown here, and these muscles right here, they're called the corrugators, and what they do is when you're furrowing them together, that's what causes these 11s. And oftentimes and for me, for example, is that when I frown, or when I think or concentrate on something, I have a tendency to furrow my eyebrows, and that's not a natural expression. It's something I've learned. So Botox can really help you retrain your muscles so that you're not automatically doing something like that.
And again, and you call it the 11 because it's almost like two lines
right there that have been etched. And you can think of constantly contracting like that will etch those lines into your skin.
Okay, great. And we'll let you get started here. And as you're doing these injections here, talk to us a little bit about how quickly someone might see a reaction or a response to this.
Right. So that's an excellent, I'll have you frown one more time. That's an excellent question. It does take actually 4 to 7 days to fully notice the effect.
Okay. And that looked easy. That's all it was, right?
Right, absolutely. So she does have a little bit of a bump there, and sometimes it might bleed, but other than that, by the time you go to your car after your appointment, they will go away. So it is a very simple process, and that's part of the reason why we wanted to do this here, is to demystify the process so that people don't think that these procedures will make you look fake or plastic looking.
Okay.
When done correctly, they only enhance your natural beauty.
Okay.
Because we have conversations about that, about how far to go, because I like my smile lines.
Sure.
I don't want to be like, oh, I can't smile. So we actually, Dr. Lamb always talks me through that, like what's the appropriate amount, how much I'm comfortable with.
Okay. What about side effects? Do you have patients ask questions about side effects, and what do you tell them?
So Botox is temporary. Most of the side effects comes from the injection itself. So you might get a little bruise right where we injected, or like I said, a little bleeding, but nothing that will last permanently.
Okay. And you can keep going here. As we're talking, you mentioned it's temporary. So how often do people need to come back, or do they need to come back?
So like most getting your hair cut or getting it dyed, is maintenance process. So about 4 to 6 months is typically when my patients come back for their Botox.
Okay. Maria, how does it feel so far? I mean, we're watching this and it looks pretty simple. How does it feel?
It's really fine. There's no, a little pinch. I'd be lying to say nothing, but it's innocuous.
Okay.
Yes.
Great. And we'll watch again as you're doing this here. And again, you're going for those 11s right there?
Absolutely.
Okay, Dr. Lamb, how long have you been doing this?
So I've been doing Botox for about 4 years now. So it's one of those procedures that I'm very comfortable with, and I know that it's safe, and it's very reliable, and it works well for most everybody. Yes.
Okay, great, and it certainly looks like you're comfortable doing it. And Maria, you look
great. But we need to make one point, because it seems easy, but it's not, and she's incredibly talented. And you have to go to somebody that knows what they're doing. It doesn't seem like it's that big of a deal, but it is. It is a very big deal. That's why it's so easy, because she's so good at it.
Good, thank you. And we know that we have a whole room full, actually, a whole call center full of very talented people and specialists who can answer your phone calls. And you do still have time to get those questions in. You can call 717-346-3333. The phone lines are open until 8 o'clock. If the phone lines are busy, you can email your question to questions@abc27.com. Deborah, we will send it back to you.
Thanks, Christina. And we also want to thank Dr. Lamb and also Maria for coming in here and doing that. Pretty brave to do something like that live on the air. Now joining us is Dr. Jessica Lighthall, a facial plastic surgeon, and her patient, Vanessa Bigler. Dr. Lighthall, why don't you talk to us? What do you do as a facial plastic surgeon?
Sure, I get that question quite often. As a facial plastic surgeon, I do both cosmetic and reconstructive surgery, basically above the collarbone. So things like nose reshaping, lifting the brows, doing eyelid surgery, but also facelifts. And then similar to what we just saw with Dr. Lamb, Botox, filler, and some laser treatments as well.
Vanessa, you referred to Dr. Lighthall. Tell me, what was your situation?
My main issue was breathing problems throughout my whole life. I had issues with sleep apnea, and I also wanted to change the shape of my nose, but the biggest issue was the medically necessary part as well.
And what was your suggestion, Dr. Lighthall?
Based on what I saw with Vanessa, most of her problems were anatomic and could be treated with a rhinoplasty.
But as you mentioned, Vanessa, you wanted to do some cosmetic surgery as well?
Yes, and that's where Dr. Lighthall was especially the best choice, because she was able to not only address the internal issues I had, but also the reshaping of my nose that I desired as well.
Talk to me about the procedure. How difficult was it? How long did it take?
The surgery typically takes somewhere between 2.5 to 3.5 hours. And we straighten the septum, which is the wall in the middle, as well as you can see from her photos, we reshape the outside of the nose based on patient preferences. So we have a discussion ahead of time about what they want.
Vanessa, there we do see the before and after pictures. How do you feel now?
I feel 100% better. I can breathe and sleep so much better at night. And as my husband will tell you, I definitely take a lot more selfies as well.
Yeah, I mean, just looking at the pictures that you sent to us, I mean, you do. What a difference. And it wasn't difficult, was it?
No, honestly, I don't regret it at all. I felt like the surgery recovery time was not very long at all, even though, you know, it'll take over probably about a year for it to fully recover, but I feel great.
What was the recovery like?
The first couple days were a little rough. I did have a lot of swelling, but Dr. Lighthall was impressed with the fact that my swelling went down pretty quickly on average. It was actually pretty quick.
Dr. Lighthall, how common is this type of problem?
Out of all the cosmetic treatments I do in the head and neck and surgery, this is the number one surgery that I do, is kind of reshaping and also opening up the passageways of the nose.
And also, how do you determine if a patient needs surgery or a less invasive procedure?
Most of it's based on exam and the patient's history, and if they've had prior traumas or treatments, and really what their anatomy looks like. If we can offer a lesser surgery and give them good results, absolutely we will do that.
We've certainly received a lot of very good information. Someone may be sitting at home, okay, I have this situation here, should I do this or should I do that? What should they do?
I think having a consult is an excellent idea. Typically we'll see you and evaluate all the areas, breathing and cosmetic concerns, and if you're appropriate then we would offer surgery, but if we even don't think it's appropriate, we can send you to another provider to help with that.
Oh, and that's true. So they're all under one roof there.
Yeah, particularly in the new Esteem Cosmetic Center, one of the ideal things for a surgeon is that I'm in a same clinic with dermatologists and surgeons that do body plastic surgery, an esthetician and skincare, and many other providers. So oftentimes if I see you and I think, you know, maybe we can do something for you, but you also have other concerns, I can just take you over and you can have a consult with one of the other providers.
And once you have the consult, how quickly can you have the procedure done?
Usually pretty quickly. It really kind of depends on operative time, but usually we're able to get you in fairly quickly.
And Vanessa, as a patient, if someone is sitting at home also wondering, well, what should I do about this? What is your advice to them?
I would say don't let fear hold you back. It has really improved my quality of life, and I would really recommend them to check out their options and definitely seek the care that they really need, especially for ongoing issues that they may have.
And since this is something that you really had problems since you were a child, is it something that you wish you would have had done earlier, or said something to someone like, hey, I really should have this done?
Absolutely, but I'm glad that I waited in the sense that I was able to have Dr. Lighthall as my surgeon, because I'm so pleased with the results.
And what is the youngest patient that you've seen have something like this done?
For nose surgery, I mean, we do congenital malformations and do nose surgery early, but typically we wait till a patient's matured and their growth is complete, unless they've had some extenuating circumstances like a severe trauma.
And it's really, as far as just with the rhinoplasty, it's something where, how long does a procedure usually take if you go into the hospital for this?
It's typically done as an outpatient, so you come in and you go home the same day. And in general, it's about 2.5 to 3.5 hours in the operating room.
So it's fairly quick.
It's fairly quick.
And it's outpatient surgery.
Absolutely.
And Vanessa, have you recommended this to any of your friends who have had problems like this?
Actually, I have quite a few, even including my mother, who needs to see a surgeon as well for her nose issues. So absolutely.
Oh, I know my husband has a problem too, and actually when we get home I'm going to say the same thing, like, okay, I think you need to call Dr. Lighthall about this. And just having this new center, I mean, this is very exciting for the department.
Yeah, we're all very, very excited. It's a very unique setting. It's rare that you find so many different specialists who provide cosmetic surgery in one facility, as well as an esthetician, and it's really a holistic care for you. And it improves, I think, patients' experience and really gets them all the treatment they need in one spot.
Right, and so now you don't have to go to, say, a Baltimore or Philadelphia. You can stay right here in the mid-state and get it taken care of.
That's right. That's correct.
Dr. Lighthall, thank you for being here.
Thank you
and
for
Vanessa,
having me.
thank you for coming in here and joining us as well.
Thank you.
And we also want to thank you, our viewers, for sharing your stories and sending in your questions, and to all of the doctors participating tonight. If you would like more information, or if you would like to schedule an appointment at Esteem, call 717-531-1386 or visit online at esteem.pennstatehealth.org. And coming up on Friday, March 9th at 12:30, join us for a special Good Day PA. We'll share 2 pediatric heart stories. One child was diagnosed when her mother was only 18 weeks pregnant. And this is the address for the Esteem Center, 5 Capitol Drive, Suite 203, right here in Harrisburg, Susquehanna Township. Telephone number again, 717-531-1386. We certainly thank you for watching tonight, and we wish you good health.